Hello, everybody. Thank you for joining me today for this session entitled New Rules, New Challenges. IMGs applying to U.S. residencies during the time of COVID and USMLE Step 1 Pass-Fail, maximizing chances of success in the match. I'm Dr. David Kuntz. I'm a general internist and I serve as DIO, designated institutional officials for 3 hospitals within our health system, which is Hackensack Meridian Health here in New Jersey. I'll tell you more about our health system in just a minute. I also serve as professor of medicine at the Hackensack Meridian School of Medicine and co-chief academic officer for our network. And I'm pleased to be here with you. And let's just jump right in. So 58.1%, what does this refer to? Well, this is the 2022 match rate for non-US international medical school graduates, non-US IMGs in the match. So we really want to pay close attention to strategies that it can increase your chances of having a successful match season. Well, I mentioned I'm part of Hackensack Meridian Health. We're a large health network here in New Jersey. We cover about 9 of our 21 counties in our state. And we have a mixture of hospitals. We have 17 hospitals in our system, 7 of which are teaching hospitals, but a variety of other types of facilities, from pharmacies to surgical centers to imaging centers, laboratories, etc. We are a system that merged in 2016, part of what was originally Hackensack in northern New Jersey, and what was then called Meridian Health in central and southern New Jersey. And so we just celebrated our 6th anniversary as an integrated health system. This gives you a little bit of insight into the makeup of our graduate medical education programs. As I said, at 7 of our 17 hospitals, we have GME programs. We also sponsor GME programs at 2 hospitals in our state that are not part of Hackensack Meridian. In total, we have over 830 residents and fellows in 69 programs affiliated with Hackensack Meridian Health. We also are a network that accepts candidates on a J-1 visa. So let me tell you a little bit about the workforce in New Jersey, and it may be similar to workforce issues in other states in the United States. First of all, in New Jersey, we have a significant reliance on and appreciation toward international medical graduates. Approximately 53% of the resident physicians in New Jersey in 2016 were IMGs. This is a higher percentage than in any other state. The reasons are likely related to proximity to New York City, family connections, and greater availability of training slots in the state and in our region. 38% of practicing physicians are international medical graduates. Despite this, unfortunately, New Jersey is somewhat restrictive as a state for resident rotations from international medical graduates. We have a state accreditation council that limits students from international schools to have experiences in New Jersey. So while there's a lot of opportunities for connections through family, proximity to New York City, which is a big draw, unfortunately, the opportunities to do weeks and weeks of training for credit in our state of New Jersey are somewhat limited. So let's just take a step back since 2020. What's really happened? COVID-19 obviously has had a significant impact on the training environment in the United States for residents and fellows. We've transitioned in terms of the recruitment cycle from in-person to virtual residency interviews, and that's going to happen again in the fall and winter of 2022, 2023. Because of the ongoing impact of COVID and the fact that we go from some COVID in our hospitals to a lot, and this limits the number of people who can come into our facilities. We don't want people traveling and getting sick and not having places to stay and issues like that. There are unfortunately limited opportunities to tour hospitals and have what have historically been called second look visits. There is some of that, but increasingly you'll find hospitals that are having virtual interviews on YouTube or on their website with like a GoPro showing what the hospital looks like. And of course, another big thing that has happened has been the transition of step one from a graded exam to pass fail. And we'll talk about what the impact of this will be on IMGs applying for US-based residencies. A few other things about COVID-19. It's really increased our focus on wellness and resiliency. And as candidates for residency, you should really be asking what programs are in place at that hospital to address wellness. And on the hospital side or the program side, we are really asking a lot about what are your strategies to deal with stress? How have you demonstrated resilience at the time that you apply? And so you should really be prepared for those questions and have meaningful answers. I'll show you some interesting information post-COVID on the lingering impact on several residencies. And I'll use two examples, emergency medicine and psychiatry. They've kind of gone in opposite directions. We don't know if they'll continue in those directions, but I'll share that information with you in just a minute, just a few minutes. There's clearly going to be, there's more telemedicine. This has really been embraced by US patients and increased scrutiny, therefore on communication skills. This was not very common pre-COVID, but now in many specialties such as family medicine, maybe pediatrics, there will be office sessions that could very well be all telemedicine, sitting in front of a computer, talking to a patient or parents of a patient, and therefore having increased communication skills, verbal skills will gain in importance. And then the ACGME has put into place a number of common program requirements, focusing more on ensuring diversity, equity, and inclusion in our residency programs. This has been in the works for a while, but it's especially important because COVID has impacted communities disproportionately. And we want to make sure that we have a workforce that matches communities where our hospitals are located. So we really need to see an increased focus around these areas of diversity, equity, and inclusion in our training programs. A lack of diversity may lead to health disparities. And as someone applying into a US residency, this would be an important topic that I would expect you to begin to know something about and be able to have a conversation with me or someone in a residency program about health disparities. This is also a focus of ACGME, and we will expect applicants to understand that improving health disparities is not just about health care, it's about addressing other social determinants of health. Well, what's some good news? So the good news is that residency positions in the US have continued to increase. What you see here are ACGME positions in the darker bar, positions that had been accredited by the American Osteopathic Association in the blue bar, and there was a merging of these two programs over the last several years, really an integration of the AOA into the ACGME. And so that's, as well as the development of some de novo, some brand new residency positions, the numbers overall have increased, and the percentage of programs that were accredited by the AOA has continued to go down, and today there really are no AOA accredited positions anymore. They've all been folded into the ACGME. In 2022, 36,277 first-year positions were offered, which represents a 3.1% increase over the year 2021. Where did these programs come from? In areas such as emergency medicine, family medicine, psychiatry, and internal medicine. So I would say those core residency programs that you would expect. And the overall fill rate in these programs, so I've already shared with you for non-US international graduates was about 58%. For US international medical graduates, about 61% of those students were able to match successfully. 91% for US osteopathic graduates, and about 97% for US MD graduates or MD seniors. So I mentioned earlier that two programs that have gone in interesting different directions have been emergency medicine and psychiatry. Now, I always counsel my own students not to put all of their eggs in a short-term trend, and these may just be short-term trends, but I think it's a reflection of what's happened in this COVID era. So if you look at the left on emergency medicine, it shows you the National Medical Residency Program data from the years 2013 to 2022. And it was very consistent from 2014 to 2021 that all residency programs in emergency medicine filled. And yet in 2022, 69 programs had unfilled positions. Now, why would that be? It's probably because, first of all, we've seen this movement towards telemedicine. We've had a movement in the United States toward what are called urgent care centers. Emergency rooms were less busy during COVID because people were fearful of going to an environment like an emergency room and being exposed to the virus. So these were some of the factors that played into, for the first time in a decade, unfilled emergency medicine positions. We don't know, again, if this will continue in the future, but you should be aware of that. Going in the other direction was psychiatry. Now, psychiatry has continued to see a steady increase in students applying into psychiatry programs. And what we think is happening here is this focus on wellness and mental health is translating into students saying, I want to be part of that treatment group. I want to help patients who are struggling with COVID deal with the mental health problems associated with living with that illness or a family member living with that illness. So it may also be, candidly, people have said, I don't want to be in a hospital environment. I'm not as comfortable perhaps going into another field that's hospital-based. So whatever particular reason, we've seen an increase in interest in psychiatry and a higher fill rate of many psychiatry residency programs. As you think about preparing your application for residency, what are things that U.S. program directors are going to look for? Well, it has to be stated that what gets you in the door is your USMLE, initially or historically it was your USMLE Step 1 score. Now you pretty much have to pass Step 1 and show a very high USMLE Step 2 clinical knowledge score. The programs are so competitive that they use these metrics to open the door for consideration of your application. You may have fantastic letters, a really well-written personal statement, tons of research, but the honest answer is unless you have a passing Step 1 score and a high Step 2 CK score, your application is likely not going to be looked at. Networking will help, and I'll talk more about that in just a couple of minutes. It's not to say these other factors are not important. We're assuming that you did pass Step 1 or you will pass Step 1. You'll have a good Step 2 score, so you are going to be in that pool of people being considered, and therefore all of these other factors, grades and clerkships, your dean's letter or your summary, your composite letter, the quality of your personal statement, and all these things are definitely important, but let's make sure we understand that it's passing Step 1 and a high Step 2 score, and also coming from a well-known international medical school helps. If you're in a hospital that has a history of accepting students from international medical schools, you have residents in that program from a particular school and they're applicants from that school, and those residents are doing well, naturally you're going to say, hey, this candidate comes from the same school that these 3 residents that are doing great in our program came from. Let's really consider them highly as we begin to plan our interview season. So the program directors, to no surprise to anyone, since we've gone to pass-fail, have put an increasing reliance on Step 2 CK. Once those doors are open, other factors that will influence program directors include your performance in medical school and the quality of your letters of recommendation, if you have had the opportunity to gain US clinical experience and maybe clinical research. So those extra items in an environment with a step 1 pass-fail are going to take on increasing importance. Let's talk for a minute about step 2, clinical knowledge. And this table is from, I'm sorry, I don't remember, one of the websites that showed the range for different specialties. But I think if you see this type of data, I would not want you to be surprised to hear that step 2 scores closer to 240 are increasingly common as the floor. Anything above that, there will be a consideration reviewing your application, but anything below that may not be reviewed at all. And I think this provides this table provides a little bit of wishful thinking that someone would be considered in surgery with a 222. I wouldn't want you thinking that. I think your goal has to be a step 2 CK at or around 240 to be considered. And again, it's a little bit of a shame because we know that individuals who will become terrific doctors may not be superb test takers, but the sheer volume of people who apply makes it difficult many times to sort out those individuals. So I do think the reality is that you will find programs that have what are called filters that just won't consider someone's application below 230, 235, 240. And above that, those applications will make it through the screening process, and then the actual face-to-face review process will begin. So how do IMGs respond? Well, they pretty much have to pass step 1 and apply with a step 2 score. So it's, I would be a bit nervous about just applying with a pass, not having taken step 2 CK or not having a score available, because they're just, that's going to be necessary for your application to be considered. Networking, if it wasn't important before, is going to be increasingly important. Knowing someone at that hospital, knowing a resident in that program, knowing someone who graduated from that program, knowing a physician who is somehow affiliated with that program you're interested in is going to be increasingly important. I will come up with some ideas. I'll share some ideas about how to do that. Be a better interview. Know something about the hospital, even about the interviewers. You can sometimes get that information from the coordinator. So when I interview a candidate for residency, I'm really impressed if they know about Hackensack Meridian Health and how many hospitals we have, if they know how big my hospital is, if they've even done a Google search about me and know what my clinical areas of interest are. So if you take the time to put in that level of detail, it will really impress your interviewers. And I'm going to talk about how you reach out to your letter writers effectively. I think many times students, whether they're IMGs or not, don't do themselves a service by having letter writers who really don't strengthen their application. Let me show you what I mean. This is some data from an article from 2019, and it just shows an example using women and students who are from underrepresented backgrounds, typically African Americans and Hispanic Latinos. And our vernacular, our use of language, can lead a person to describe women, for example, with a personal attribute such as lovely or something else similar to that word, or an underrepresented student as pleasant, which are not strong words in a letter. A student from a majority background may be seen as competent, determined, dedicated. Those are just terms, and it can put some candidates in a better light and some candidates who are equally qualified in a lesser light because the language is not as strong. So you want to make sure that you have letter writers who will be willing to use strong words that describe your competence. Words like he or she is scientific, he or she is knowledgeable. And so how in the world do you have that conversation with a letter writer? It can be a little awkward. If you know that letter writer really well, you might say to him or her, can you please use language in my letter that really speaks to my competence, to my dedication, to my determination to be successful? If you can use those words, and hopefully I've impressed you with those attributes, that would really go a long way in supporting my application. So sometimes be proactive and specific in the language you ask your letter writers to use, so that what he or she thinks is a good letter really is a good letter to someone on my end who's reading the letter. I think networking, let's face it, is increasingly important. You're one of thousands of applicants. It could be critical to gaining experience in the United States. You might want to do things like create a professional profile on a professional social media site like LinkedIn. Maybe you've had an article published. Maybe there's a nice picture of you standing in front of a poster at a meeting. That kind of information will allow you to network, and you can mention where you're going to medical school. Someone may see that who's at a US hospital where there's a residency and say, hey, I went to the same school. I'm so happy to see what you're doing. And you can create a relationship that way. I've already said, learn who is from your school in that residency fellowship or on the medical staff. Or consider joining a professional society as a student member. And that's another way to get into networking. So I really encourage people to take these or related steps to start creating those contacts that can help you gain that interview. Why is US experience so important if you can achieve it? Experience of patients within our system can be different than elsewhere. And programs don't have time to fully acculturate you. So a program will have a lot more confidence if they know that you've spent some weeks or months shadowing a physician in the United States. So you have some feel for what the doctor-patient relationship here. Having a US-based physician validate your skill set, interest, and motivation is critical to be considered a strong candidate. It also will demonstrate that you're up to date regarding clinical care in our country. You're up to date with medications, with guidelines. In hospital experience is not a must. You might just be in a doctor's office, but it can certainly help, especially if you're looking at a hospital-based residency, such as emergency medicine, internal medicine. Having that experience in a hospital, if you could gain it, obviously is a big advantage. Personal statement, and this is a slide that you can read later on at more detail. What are some things I think that are rather standard? We want to see motivation for your field of study. What you did or will do in advance of the residency program, that you're clearly a hard worker, that you recognize and acknowledge that you're a hard worker, that you understand the issues involved in the delivery of care in our country. I've already talked about social determinants of health, the importance of quality improvement and patient safety, having a degree of humility to learn from one's mistakes. We'll want to see or hear language that speaks to those types of issues. Evidence of interest outside of medicine. So we were talking earlier about wellness and resilience. So what do you like to do outside of medicine? I don't want someone who says, I want to be at the hospital 16 hours a day. Not interested. What do you see yourself doing in 5 to 10 years post-residency? Interested in kind of what you see your career path being. And it has to be perfect. There can be no grammatical mistakes. There can be no sentence structure mistakes. There can't be a sentence that has 2 periods because you missed it when it was typed. You have to get someone to really proofread it carefully, both content and grammar and how the personal statement is structured. To maximize chances of success, understand what derails candidates from getting interviews. So let's say you are at that stage where you have those great scores and a program's considering you. Make sure your application is accurate, complete, and free of mistakes. And sometimes it's hard to look yourself at something over and over again, and it benefits you to have someone else look at your material. If there are time gaps, we need them explained. It's okay to say, I've been in the country for a period of time preparing for a STEP exam or applying for residency. That's fine. What can derail a candidate is, I don't know what you did for a 2-year period. There's just no explanation. And it leads me to think something bad happened or something you don't want to tell us about. And if there's anything that will create a degree of uncertainty, your application will be passed over. I've already talked about problems with the personal statement. Letter recommendation issues. I've talked a little bit about language from the letter writers, but also if it's too generic, if it's sent to the wrong specialty, if it's only from your home country, it would strengthen your application, as I said earlier, to have letters from a US-based physician. I'm sorry to say, for those of you who don't have the opportunity to gain a lot of US experience, that too little experience, just 4 weeks in someone's office compared to a candidate equally qualified who spent 3 months in a busy clinic. Well, we're going to feel more confident that that person who spent more time in a busy clinic has a better understanding of some of the issues in our health system. And then applying too late in the application cycle. You really need to time it so that you get your applications in as soon as the portal for that individual program is available. What are some opportunities that may allow you to stand out beyond research or US experience? Well, we have a program in the United States called CITI training. CITI stands for Collaborative Institutional Training Initiative, www.citi.org. And it's a free training in areas of research ethics and compliance. It's free of charge. You may have to have a home institution that's part of the CITI program. But if you have the opportunity to take it, adding that onto your resume would show, one, some additional initiative, and two, that you have a better understanding of research compliance, of ethics, and I think would strengthen your application. Similarly, the Institute for Healthcare Improvement in the United States, it goes by the initials IHI. You can Google it. There's also the opportunity to take and pass free courses, and this is around patient safety and quality. Many residency programs require IHI training during residency. And so if you have some experience in advance and can talk about what you've learned about safety and quality, that could be a big advantage. We have a very diverse, many of our communities in the United States are very diverse in every dimension. So if you speak more than one language, let us know. That should be prominent on your application. A hospital where you are looking to do residency may have a large population of individuals who speak a language that you do. And so that would make an immediate connection. And then I'll tell you about a way that we're trying to create opportunities for international medical graduates to gain some of these experiences in our system. So here at our hospital at Jersey Shore University Medical Center, part of Hackensack Meridian Health, we have an 11,000-foot simulation laboratory. It's really a wonderful facility in a building across a small area from our hospital proper. It's the 9th floor of a 10-story building where we have a lot of clinical activity, where we have our cancer program, our research program, and our simulation laboratory. The simulation laboratory has 2 components: a number of high-fidelity mannequins where students, residents, technicians, nurses can train individually and in teams on these mannequins that change vital signs, learn how to work in a team environment in an acute setting. We also have essentially videotape doctors' office rooms where we work with what are called standardized patients, where students gain experience interviewing standardized patients and gaining experience with US patients, basically. And it's really very proud of it. It's a terrific facility. And we're working to create opportunities for international students to spend weeks at a time in our center. I already mentioned a couple of things. I mentioned CITI training earlier, and so we will walk you through CITI training. If you were are interested in this program. It's flexible learning, and you'll be interacting with some of our program directors. We will provide experiences such as mock interviews. We're located in a community about an hour from New York City. You could take the train down to about 2 miles from this complex, and you really won't need a car. So you can make it to this community and without a car and spend several weeks in our center, and we're really excited to welcome you. So let me stop and summarize that first of all, we rely very much on international medical graduates in the care of patients in the United States. So we're appreciative of the interest and the commitment to our patients. It is challenging to gain residency, looking at the statistics overall, but I hope I've given you some tools and some strategies to make your chances of matching even better. And at the end of the program, I've described to you our simulation center and some new experiences we're creating for later in 2022 and beyond. And I'll make available a link to a video that'll actually show you our simulation center in action. So thank you for joining me today, and I look forward to your questions.